This is going to be my video for extra credit on the chest tube skill. So first I'm going to be doing a room scan. I have all my materials here. Just making sure we got a good view. Hi, I'm Leola. I'm going to be your suit nurse today. Could I get your full name and date of birth? Perfect. And do you have any allergies? No? Okay, I'm going to do hand hygiene, provide for privacy. So looking at the provider's orders for today, it looks like I'm going to be helping him with your chest tube. I'm going to help him with the final parts of insertion, and I'm also going to be doing a sterile dressing change on your chest tube. As of right now, do you have any questions, concerns, anything like that? No? Perfect. Okay. Set those to the side. I have my tape ready, the two different types of tape. So I'm going to set this roll to the side. So, making sure he's in the right position, and what I'm going to do first, I already did hand hygiene. I'm going to put on some just normal gloves so I can help the physician finish the rest of the insertion process for the chest tube. So, I'm going to take the long end of the chest tube, long to the ligament. I'm going to take the cap box, set it to the side. I'm going to insert it sterilely. And I use tape to make sure it stays together. Some places use zip ties. I'm just using regular tape. And then I'm going to unclamp this, set that to the side. And I'm going to connect the patient's chest tube to suction. Perfect. Just gonna look at this, making sure that everything looks appropriate. Gentle bubbling in the suction container, and then no bubbling in the water chamber. Making sure it's idling. Now that I've checked that, I'm just gonna place it on the floor here, straight up. I'm just gonna turn down a little bit. All right, so now that I've done that, I can take my gloves off. And I would throw them away. For the purpose of this video, I'm just gonna set them to the side. So now what I'm gonna do is I'm gonna start with the chest tube dressing change. So I have my gauze, making sure nothing's expired or out of date or anything like that. So I'm just gonna start with the forceps. Opening them sterilely. Okay. Now I take my gauze, I'm just going to open it up and then put it onto my sterile field. Set this to the side. Same thing with my split sponges. And before doing this, I would have already also re-washed or gelled my hands. Then for petroleum gauze, I'm just going to do something a little bit different. I'm going to open it up. And just set it to the side without touching. Just because it's a little hard to mess with. Okay, now I am going to put on my sterile gloves. Now I'm going to stand to the side so you won't be able to see me, but I will talk to it as I go. So I'm going to put on my sterile gloves, opening up the package. Doing my non-dominant hand first. And then swooping with my other hand. Alright, now that I've got my sterile gloves on, I can touch the field. So I'm going to start with the petroleum jelly. So I'm just going to touch the outside border and grab the petroleum gauze, and I'm just gonna fold it up like a hot dog so I can put it around the chest tube, making sure not to touch the insertion site. Sacrificing one of my hands, and I'm holding the tube. Got it on there. So now I'm going to use my forceps to kind of wrap it around. After I've done that, I'm just going to put those to the side, and I can start with my split gauze. So I'm going to do one on one side, and I'm going to do one in the opposite direction. And then my gauze, put that on top. Now I'm done with the sterile part of it. So I'm going to take my 3 pieces of tape and put them on, making sure it is secure.
A little bit.
And 3rd piece of tape. One more time, the initial. And then from here, I'm just going to take my gloves off, these sterile gloves. I'm going to gel my hands, and I'm going to grab another pair of gloves just while touching the chamber and whatnot. So I'm going to put on a new pair of gloves. I already did it initial, I did hand hygiene again. So now I'm just gonna inspect, making sure everything's working how it's supposed to. So I'm just gonna feel around the client's skin for any subcutaneous emphysema. So any feeling of crackliness, like Rice Krispies under the skin. I'm gonna assess the tube itself, making sure there's no kinks or dependent loops. I'm gonna make sure that the drainage is looking good and observe what kind of drainage it is. If it's like bloody, pussy, milky, like lymphatic, or just serous, nice and clear. And then from there, I'm going to look at the output of how much we're getting for output. I'm gonna make sure that the water chamber is tidling with each breath, and the suction chamber is efficiently bubbling gently. And I'll make sure to check on my patient every 15 minutes for the first 2 hours of doing the insertion of the chest tube, and from there I will just make sure to do hourly checks. And that is the end of the skill. Is there anything else I can do for you? No? Perfect. So I just take off my gloves to hand hygiene and document and leave the patient with their call light.